Hi, I'm Ruth Hanston, and I'd like to spend some time today having a conversation with you about the critical juncture of shift report. You know, as we travel the nation and work with hospitals, we notice that there's a trend of nursing assistants offering shift report to each other at the exclusion of RN input. We think there are some hazards in this practice, but we would like to offer a few questions for your unit practice councils or for your management councils to discuss. The first is, what is the purpose of shift report? What kinds of information needs to be shared, and who needs to know that information? And what else could be happening during the time of shift report that would allow engagement of the nursing assistant with the patient and the RN, and allowing for the RN to offer some initial direction and a plan for supervision of the tasks that need to be done at the bedside. Let me just share a scenario of something that occurred when we were consulting with a hospital. We were there, of course, at shift handover, and we noticed that there was a nursing assistant to nursing assistant shift report. So I listened in to find out what kind of information was being shared. The nursing assistant that was off-going shared with the oncoming nursing assistant that Mr. Jones has been having some trouble with ambulation today. His left side is kind of drooping, his face is in a grimace, and so we really need a two-person assist for him on your shift. Well, I immediately asked this nursing assistant, what did the RN say when you told her about the change in his ability to move his left side and his face being droopy? And she said, oh, I didn't tell her. I just wanted to make sure that we had enough staff for the next shift. So this situation exemplifies the kinds of information that may not be shared to the RN when there is nursing assistant to nursing assistant shift report. And what we also see occurring is that sometimes RNs don't know about basic care processes that are occurring or being omitted at the bedside. We find that when the case manager or the social worker comes to talk to the RN about the patient and the disposition of the patient to the next level of care, and they say, gee, can they go to assisted living? Can they go to a nursing home, or can they go home? Can they ambulate? Can they swallow? What's their mentation? And the RN may not know. And they have to go and ask the nursing assistant, because what we're seeing happen then is completely disconnected parallel practice, even though the registered nurse is accountable for the total nursing care of that patient. So we ask you to think about what are the opportunities inherent in having a nursing assistant involved in the shift report at the handoff at the bedside with the patient and the nurse that she will be working with during that shift, so that there's engagement with the patient and family, and there's a plan that's established during that period of time. Thank you for joining us in this conversation about shift report at the bedside and specifically nursing assistant to nursing assistant shift report.